Hello. Today I will be giving a presentation on understanding bipolar disorder. My name is Dawnett Faucett. I am a student at Galveston College. I am taking General Psychology 2301 under Dr. Kavica Williams. Today's presentation, Understanding Bipolar Disorder, we will discuss definition, statistics, types, diagnosis, treatment, and support. First, you may ask, what is bipolar disorder? Bipolar disorder, by definition, is also known as manic depressive illness. It's a brain disorder that causes unusual shifts in a person's mood, energy, and ability to function. The symptoms are severe. It involves dramatic shifts in mood from the highs of mania to the lows of major depression. The cycles of bipolar disorder may last for days, weeks, or even months. Unlike ordinary mood swings, bipolar disorder is much more intense and disruptive to everyday functioning, affecting a person's energy, their level of activity, their judgment, and behavior. The first manic or depressive episode of bipolar disorder usually occurs in the teenage years or in early adulthood. Bipolar disorder affects over 40 million people in the world, and 2% of people are affected by bipolar disorder at any point of time during a year. 2.9% of adolescents suffer from bipolar disorder. Women are more likely to suffer from bipolar 2, and bipolar disorder is the highest percentage of severe impairment among all mood disorders. There are 4 types of bipolar disorder. Bipolar 1, manic or mixed episode. A person will usually have at least one manic episode in their lifetime. The bipolar 2, hypomania and depression. Individuals with this variant of bipolar disorder can experience an episode of major depression, which may sustain for 2 weeks or more. Cyclothymic disorder, which is hypomania combined with mild depression, characterized by less intense, shorter episodes of depression and then hypomania. Then we have bipolar disorder other or unspecified. It's another form of bipolar disorder where a person does not meet the criteria for bipolar 1, 2, or cyclothymia, but has still experienced periods of clinically significant abnormal mood elevation. So now you may ask, how is bipolar disorder diagnosed? Bipolar disorder is a complex condition, which can make diagnosis difficult, even a lengthy process that can require a multidisciplinary team. Assessment typically begins by comparing one's lived experience with the DSM-5 classified bipolar symptoms. Additionally, the doctor will ask for a medical history, family history, and may even conduct a physical exam, order lab tests to rule out any other condition. Healthcare professionals may begin with a range of diagnostic tools and assessments to gather information and assist in making a diagnosis. One commonly used tool is the Mood Disorder Questionnaire, which is a screening tool designed to identify symptoms of bipolar disorder. The MDQ includes questions about mood changes, energy levels, and other symptoms commonly associated with bipolar disorder. The Bipolar Spectrum Diagnostic Scale is another commonly used assessment. Treatment is best guided by psychiatrists who specializes in diagnosing and treating mental health conditions, who is also skilled in treating bipolar and other related disorders. The person with bipolar may have a treatment team that includes a psychologist, a social worker, and a psychiatric nurse. The primary treatments for bipolar disorder include medications, psychological counseling, psychotherapy to control symptoms, and may include education and support groups. So now you might find yourself asking, can a person with bipolar disorder live a happy life? Well, according to the Depression and Bipolar Support Alliance, the short answer is yes. A person living with bipolar disorder can find happiness in life. Proper diagnosis and treatment can help people with bipolar disorder lead healthy and productive lives when you recognize the symptoms and work with your treatment team. There are steps to take to success in any endeavor, and according to medical news today, people can take certain steps to help improve their overall health and reduce the symptoms associated with bipolar disorder. We can all begin by eating a nutritious diet, exercising regularly, getting regular sleep, keep a structured schedule, avoid drug and alcohol use, learn your personal triggers, and develop a plan to avoid them. Keep track of your appointments using calendars and remember to attend each one. Develop healthy, stable relationships and then go to treatment and stick with it. Now you might be wondering, how can I help? If you have a loved one who has bipolar disorder, here are some tips from verywellhealth.com. Support your friend or loved one, first by understanding the condition. Educate yourself on the disorder and what type of disorder they have. Be alert to their symptoms. Make note of symptoms and what triggers them. Listen and communicate. Be an active listener and establish healthy boundaries. Support treatment. Encourage them to keep up with treatment and take their medication. Lastly, take care of yourself. Remember to take care of yourself through support from others, therapy, and practicing self-care. Again, my name is Dawnett Faucett. Today's presentation was Understanding Bipolar Disorder. I hope that this has raised your awareness, given you some education on the subject, and encouraged you to be supportive of others if you know they have bipolar disorder. Thank you, and have a wonderful day.